loved one to any disease is traumatic. Losing a loved one to a disease owing to fear, ignorance, and misinformation is even more traumatic. Cancer is one of the major lifestyle diseases, or NCDs, and although it may not be thought of as such, it is one of the comorbid conditions that you have been hearing about when we speak about COVID-19. Cancer patients are considered part of the high-risk group when we speak about COVID-19 infections. There's a notable increase in the risk of complications and death in this group when infected by the SARS-CoV-2 virus, and even more risk with the Delta variant, which is currently in our community. We at the Trinidad and Tobago Cancer Society always remind the population to give yourselves a fighting chance through healthy lifestyles and screening. Today, we ask all of our cancer community to give yourself a fighting chance against COVID-19, and along with the 3 W's, add the V and get vaccinated. I can understand the fear, the hesitancy, and the uncertainty. Truly I can, but at the same time, I ask that you speak to your doctors, get the correct information, and get vaccinated. We hear a common theme. We don't know enough about the COVID vaccines. The vaccines will kill you. You can still get sick if you take the vaccine, and the list goes on. But we do have historical data since 2002 on these vaccines, as they were first created to combat the SARS and MERS epidemic in Asia and the Middle East, respectively. We know that the vaccines against the COVID-19 virus provide an added layer of protection. We know that it provides a 97% reduction in your having a complication or death due to the COVID-19 infection. Can I tell you what we truly may not know? We do not know what the SARS-CoV virus is capable of if you do get infected by it. We know that this virus has up to a 25% chance of causing death or complications in cancer patients, the high-risk group. This vaccine allows your body to have a jump start on recognizing the virus, and therefore allows your immune system to be ready and waiting, and therefore much more effective in fighting and clearing the virus from your body. The vaccine allows for a reduced risk of transmission of the virus, so we protect those who cannot take the vaccine, and it allows for milder disease should you get infected. Cancer is already a battle that your body has to fight. We always speak about how to help your body through this journey with cancer to conquer and to survive. But not only do you now have to worry about dealing with cancer, treatments, emotions that are raging, but we also have COVID-19. Let us help you worry less. Let us truly protect our most vulnerable. I know that there's a lot of misinformation out there, but it is known at this time that cancer patients are eligible and encouraged to get vaccinated. There are very specific situations where the vaccination schedule is delayed, and these situations are highlighted by your oncologist. Most commonly, it is if you are currently undergoing active radiation treatment, which will suppress your immune system, and therefore we will delay your schedule. But please have that discussion with your oncologist or your oncology team. But ladies and gentlemen, I am not here only to speak to cancer patients, but most importantly to their relatives and caregivers, their support circles. You're there for your loved ones, helping them through this journey with their disease. But if you're not vaccinated, you are in fact potentially able to cause more harm than good. This has been converted into a pandemic of the unvaccinated to a large degree. We cannot afford to lose this fight now, owing to misinformation and division of our population. My last and most important advice to you today is the importance of screening. Along with maintaining healthy lifestyles, we implore and encourage you, both men and women, not to delay your screening. We have seen that a delay in screening due to COVID-19 has happened over the past year, and it's because of the COVID-19 presence in our community. As long as you are not symptomatic, that means you have no symptoms, you have not had a recent contact with a confirmed COVID-19 patient, and your screening is due, kindly reach out to your health centers, your healthcare practitioners, and the Trinidad and Tobago Cancer Society for your screening. Screening allows for early detection, and along with maintaining healthy lifestyles, it will allow for an increase in survivorship, our best weapon against cancer. Get screened, for prostate cancer, cervical cancer, breast cancer, and colorectal cancer. This is a global fight against cancer and now cancer and COVID-19. We have to do this, and we can do this. Healthy lifestyle choices, get screened, the 3 W's, and get vaccinated. Thank you so much.